Hi guys, it's Dr. Burke again with more podcasting from my den. And what I want to do is try to just show you how the heart works. If you need to know, if not, you can ignore this. So for me, I always need the kindergartner's method on how to learn about anything. So forgive me, this is how I teach. When we draw our heart, I usually start with a big oval. And then I separate it into fourths like so. And in looking at this, if I'm looking at a patient, what I would do is say, okay, here is my left ventricle. Here is my right ventricle. Here is my right atria. And here is my left atria. Then I think about where is blood coming from and going to in the heart, because when we're trying to learn about valvular disorders or heart failure, this becomes very important. If you can draw this and you understand the flow of blood, you'll understand what happens when valves fail and when the heart pump fails to pump blood forward and how blood will go backward. So, the basics. We can start on the right side with our deoxygenated blood, and our right atria receives blood from the body. So that's deoxygenated blood from the body through the vena cava and coronary sinus. Vena cava. So this blood that is deoxygenated from the body is coming into our right atria, and it has to go through this magic trapdoor known as the tricuspid valve. And I always write it little t, capital R, capital I, and then lowercase the rest of the word. So that I always remember that the tricuspid valve is on the right side of the heart. Next, blood goes through that magic trapdoor into the right ventricle. And if this heart is working appropriately, then blood is going to go to the lungs. And how's it going to get there? It's going to get there by means of the pulmonary artery. Means of the pulmonary artery. So blood from the right ventricle will travel to the lungs. It will have to bypass the pulmonic valve on its way out, get into the pulmonary artery, and then participate in gas exchange in the lungs. Once gas exchange in the lungs has occurred, then blood is coming from the lungs by means of the pulmonary vein. This pulmonary vein, very special because it is the only vein in the body that's going to carry oxygen-rich blood. And so this blood comes into our left atria, has to go through its own magic trapdoor to get into the left ventricle, and this magic valve is known as the mitral valve. I always spell it little m, little I, little t, little r, little a, capital L, and then I remember the mitral valve on the left side of the heart. So then blood wants to travel from the left ventricle, which is very important. Left ventricle wants to go to the body by means of the aorta. And in order to do that, the left ventricle is going to have to pump blood past the aortic valve. A few very important things now. If we take a look at this, blood into the heart, all blood entering the heart is venous. So in order for blood to get into our ventricles, we have to have venous return. And the blood in our ventricles at the end of diastole is known as preload. So this is blood. We have blood on the left side of the heart or in the left ventricle at the end of diastole. That's called preload. And we can measure this volume of blood by the pressure it exerts on the ventricle. So on the left side of the heart, this preload, we call it LVEDP, left ventricular end diastolic pressure. And on the right side, we have RVEDP, right ventricular end diastolic pressure. That's preload. So preload is the volume of blood in either ventricle at the end of diastole. Diastole is the resting phase of the heart. In order for us to have any preload, the only way it could have gotten there is through a vein. That's very important. All venous return is preload. So if we have decreased venous return, then we're going to have decreased volume in the blood in the ventricles at the end of diastole. All right, and just to wrap it up, in order for our heart to pump blood to the lungs or to the body, we need arteries. So all blood leaving the heart is arterial in nature. All blood entering the heart, venous in nature. Preload is determined by venous return. And all blood leaving the heart is arterial in nature. So think about that and bring that back to pharmacology. Think about all those agents and how they worked. Many of them were vasodilators. Vasodilators usually lower our blood pressure because we'll have decreased venous return, right? And then we have vasoconstrictors. And vasoconstrictors constrict the arteries. They actually make our blood pressure go up. Well, I hope this was helpful to you.